Hello, I'm Peter Quintana from HGKC. I'm delighted to be speaking today to Kate McEwan, owner of Lotus Reflexology, an holistic approach to foot care, about the potential project. It's long been a source of frustration to Kate that the positive impact of reflexology on the management of anxiety in children and teenagers with autism, and consequently behaviours of the challenge, is not more widely understood. The potential project offers 6 treatments to children or teenagers with autistic spectrum condition and forms part of Kate's research into the positive impact of reflexology in autism. So welcome, Kate. It's lovely to see you.
Hello.
So can I start by asking how you started working with autistic children?
Well, it was accidental. I've been a reflexologist for 18 years, but in part of my time as a reflexologist, I did a project management job in a women's centre in Swansea, and chatting to one of my workers who had an autistic teenager, she sort of mentioned that he really liked having his feet rubbed, and did I think that reflexology could be of any benefit? And I did my normal thing of saying, well, you know, there's only one way to find out, let's give it a go. And we were both quite stunned with what happened. So yeah, and it just went from there. He was a lovely 14-year-old boy when I met him, but he was going through a lot of teenage things. So he had all the testosterone surges of normal teenage boys, but also the inability to describe that and describe his frustrations and manage his anxiety and express it. So as is very common with autism, he because he couldn't communicate effectively, he would have meltdowns or blow-ups, and he had sort of behaviours like pacing. So he wouldn't sleep for more than about 3 or 4 hours a night, but he would pace the rest of the time. So he'd just be in his bedroom pacing, and it was a very disturbing effect on the family. And you know, or he'd be in the supermarket with his mum and he'd start to experience sensory overload from all the sounds and the chaos and the general kind of mayhem that you get in a supermarket, and he would just start to have this massive meltdown. And before she knew it, the security guards would be running over, everyone would be staring, and it was really horrible.
Interesting.
Yeah, and you know, there's nothing wrong with any of those behaviours. They're a way of trying to communicate distress, but in certain situations, they're really unsociable and they put people under a lot of pressure. So nobody should ever be looking to sort of cure autism or stop behaviours, because, you know, they're all useful. But what you want is you want to stop them from preventing people from reaching their potential. You want to stop those behaviours from preventing children from staying in school. So what happened was I worked with him every week for probably a few years, but within a few weeks, the pacing started to calm down. I think after 3 weeks, they came back, and she was absolutely astounded, because he'd gone home after the treatment on Friday, and he got straight into bed and he'd slept for 36 hours. So she'd had that moment that you have when you've got a baby and they sleep for much longer than they normally do, of like wondering if he was like even alive. And then he was just really calm, and it just carried on like that. So it wasn't that he never had meltdowns. It wasn't that he never paced and he never did anything expressing distress, but it had gone down so much that things were a lot more peaceful.
Presumably because you know, somehow you're able to reduce his anxiety level. So what is it about the reflexology treatment that you think they like then, or you think that helps you to deliver it to them?
Well, I think with anybody that enjoys being touched to a certain degree, if you don't have a problem with being touched, you'll probably like reflexology, because I mean, obviously different practitioners differ, but the effect of it is very pleasurable. It's nice having, you know, it's nice having someone touch your feet anyway. There are a lot of nerve receptors, so it's a very sensitive area. And then the reflexology treatment, the experience is quite an intensely relaxing one. So 9 times out of 10, most people will enjoy it anyway. But if you're someone that enjoys touch particularly, then it's, yeah, that benefit is magnified.
You obviously have an empathy with autistic children, which I'm sure you need to be able to work effectively with them. What do you put that down to?
Well, I'm not in any way related to anyone that I would consider to be have an autistic spectrum condition. You know, people often wonder if my children, you know, have anything, and I couldn't really say that that's true. But what I have had is when I was younger, throughout my school years, I was really, really badly bullied, probably over a period of about 10 years. And while that's not the same, what it did give me is it did give me the sense of being an outsider. And that's something that I've had all through my life. So even though now I have lots of nice friends and, you know, I'm in good friendship groups, I'm still often regarded as a little bit odd, not quite fitting in, not quite chiming with people sometimes, which doesn't mean to say they don't like me, but sometimes people just do find me a bit awkward. And I think that's kind of given me a bridge. It doesn't mean that I understand what these children and teenagers are going through in any way, but I can understand what it's like not to feel like you fit in all the time and to feel like you're an outsider and that people don't really get you. I really can understand that. And I think that's enough.
Okay. Okay. The potential project forms part of your research, doesn't it? What's the aim of your research?
Well, I think it's possibly safer to call it data collection at the moment, because I wouldn't want it to be confused with a proper scientific trial. The aim is, it comes back to my frustration that I believe that there are really positive benefits that children with autism can receive from a reflexology treatment. I believe it can make a big impact, but it's also something that's not widely known about. Most people don't even understand what reflexology is, let alone have even thought of it as being a beneficial thing for a child with a severe condition. And so I think what I want to do is I just want to put something together that explains a bit more about why it can be so effective. So I'm trying to gather data that will in some way evidence this a little bit better than it is at the moment. There was a very good Egyptian trial in 2019, which was run by a university hospital and had very, very significant results, but it only worked with 30 children. Okay. It was overwhelmingly positive, but it was very, very small. So there's a lot of scope for something a bit bigger.
Okay, so how many children do you want to work with then?
Well, I want to start with 100. Okay. Because that's a nice round number.
It is a nice round number. And then do you think that once you've got the data, you'll be able to, is your intention to interpret that through the scientific, the science that you already understand behind reflexology in order to come to your conclusions and explanations? Is that the approach that you'll take?
Well, I'm the main measuring tool is what we call a MIMOP questionnaire. You ask the same questions at the beginning and at the end of the series of treatments, and they center around symptoms that people are unhappy with, and you measure how people feel about the symptom on week 1, and then you measure it again on week 6, and that should give you a fairly decent empirical idea of whether people feel there's been an improvement in that symptom. So, I mean, that's how it's going to be measured. And what I hope to do is use that to sort of say, well, as far as it can be measured, this is what working with 100 children has shown.
Okay, okay, good. Any success stories yet?
Well, yes, I mean, because we're in a pandemic, obviously, and that has had its natural limitations, but over the last 6 months, when I have been able to do the case studies, 3 of the children that I've worked with were school refusers. I think one of them was going in occasionally, but not regularly, and the other 2 were just not going in at all. And now they're all back in school full time. And the only thing that was different was them having the reflexology. So their parents do feel that the reflexology had a significant impact on getting them back into school.
And that was the six treatments that you
6 treatments,
offered
yeah.
through the potential project.
Yeah.
Okay, that's really promising, I think. Just before we wrap up, do you just want to give me a quick outline of potential projects and how people can get in touch with you if they're interested?
Okay, well, it's based in Bristol, so obviously you have to be able to reach me in Bristol. I have obviously a website, which is www.lotusreflexology.co.uk. All my contact information is there. It's mainly telephone, so please call me, and you know, I'm available to have a chat at any time and just to talk through any questions or concerns that people have. And if, you know, if there are people that want to try their children on the reflexology project, then that's great. If they just want to find out more about it, that's also fine.
Okay, and now that we are able to travel a little bit more, are you able or willing to visit, or do these children have to come to your clinic?
No, it's going to be clinic based, because as far as possible, we need to make sure that the conditions are the same every treatment. So it's quite important that the children come to the same place every time, I believe, because they'll, you know, when people start, sometimes, you know, if the children are young, maybe they're non-verbal, you know, it takes a while to get used to the place and to me. So it can take a while to get the treatment going. But if we were shifting it around or going to, you know, their house one week and coming to the clinic another, it would just be too variable.
Okay.
So,
All right.
yeah.
It sounds reasonable enough and good foundation for it. All right, I think that's great. Thank you very much indeed for this, Kate, today. And if anybody out there is interested in contacting you, well, contact Kate by telephone, or which is published on her website, www.lotusreflexology.co.uk. Thank you very much.
Thank you.